pediatric ear, nose, and throat medicine. I'll be talking about risk factors that predispose children under 3 to complications after a tonsillectomy. But let's take a step back, to the back of the throat. This is where your tonsils and adenoids are located. They're made up of lymphoid tissue, the same kind of tissue found in your spleen and lymph nodes. When your body has an infection, your white blood cells take the bacteria and viruses to the tonsils and adenoids to fight it out. Think of them as big boxing rings. Normally, your tonsils don't cause you any problems. You could live with them or without them. But they start to become an issue when they lead to frequent strep throat, ear infections, difficulty breathing, and sleep apnea. Yes, kids can get sleep apnea. It's more common than you think. The picture on the left shows the location of the tonsils and adenoids and the normal size of the tonsils, but the picture on the right shows that the tonsils have gotten so big that they're starting to occlude the back of the throat. These are called kissing tonsils because they're practically touching. So, what do you do when the tonsils become a problem? Take them out. Tonsillectomy is a relatively quick and easy procedure done in the outpatient setting. Most kids do remarkably well and are able to go home that same day. But there was a paper published in the 90s that suggested that children under 3 are more at risk for complications after surgery and thus should be kept overnight for observation. These complications include difficulty eating and drinking, nausea and vomiting, difficulty breathing, and bleeding at the incision site. Well, the pediatric ENT and I weren't so sure that kids under 3 really needed to stay in the hospital overnight. What if there was a list of risk factors, a guide that doctors could use to let them know whether their pediatric patients would be more at risk for complications after surgery? So we analyzed 250 cases of tonsillectomy in Palm Beach County and isolated 3 main risk factors. They were 1, history of the use of nasal steroids, 2, history of difficulty swallowing, and 3, history of ear tube surgery. If the patients under 3 had any of these 3 risk factors, then the doctor should probably keep them overnight for observation. But in children under 3 without these risk factors and no other contraindications, well, they can go home that same day. This will save parents and insurance companies a lot of money for an overnight hospital stay. Plus, the kids will be less likely to pick up an infection from the hospital, and the toddlers can recover comfortably at home, eating ice cream. Now that is something that's easy to swallow. Thank you.